My name is Disha Ganjigute, and I am an Honors College Nutritional Sciences major.
Hi, my name is Peyton Daniels. I'm a sophomore. I'm an Honors Sciences and a Humanities major.
I'm Sarah Timmons. I'm Program Director for First Year Experience Program in the Honors College.
Hi, my name is Dominic Casadante, and I'm a Minnie Stevens Piper Professor here at Texas Tech University.
My name is Saba Nafis, and I was a math major at the Honors College, class of 2014.
Hi, my name is Dr. Ibtisam Islam. I'm a pulmonary critical care physician at Texas Tech University Health Science Center. I've been taking care of COVID patients in the intensive care unit at Texas Tech University Health Science Center and University Medical Center for the past 20 months.
So I'm a mom of 2 young children who are still too young to be vaccinated yet. And while I recognize that everything I'm exposed to, I then bring home to them. And so it's incredibly important to me that I am being as careful as I can, taking every precaution that I can, so that I'm not inadvertently exposing them to something that could make them sick and potentially alter their lives.
In February of this past year, I got a call, actually a text in the middle of the night from my brother saying that my younger brother had essentially fallen down the stairs in the middle of the night and was taking my ambulance to the hospital. And they suspected that he had COVID because he had been coughing tremendously for about a week before. He gave COVID to everyone in my family, and within 2 days, he couldn't breathe. And so he was intubated for about 30 days, and we just watched him progressively go down the hill.
At the beginning of January 2021, I had the honor of traveling up to Washington, D.C. and working at the House of Representatives. While I was working on the Hill, I got a phone call from my mom saying that she, my sister, my grandma, and my dad all had caught COVID-19. The vaccines weren't ready yet, so she had taken all of the precautions, and the rest of my family had all taken precautions to make sure that they were social distancing, wearing their masks, and not traveling out into public unless it was for their jobs or for an emergency. And yet, the virus still caught up to them.
I have only 70% lung function. I also have vasovagal syndrome and really severe asthma. I'm really prone to getting really sick, and so I was very frightened by the idea of COVID.
It is very difficult to talk to families who are not allowed into the COVID rooms. They do come and visit from the doorway through the windows. There's a lot of conversation that I'm having with these family members. If the patient's awake and able to talk from their phones, we'll dial from their phones, and I'll show them what the room looks like and what the patient looks like so they can see what the situation is. With all the tubing and the machines and the pumps, I try to help them visualize and see as much of the room and the situation as much as possible.
Well, I came home after spending about 30 days up in Cleveland, and then 4 days later, I got the call in the middle of the night that said he had passed away. So COVID is very real, and it's very serious, and you can be in the best shape, and it can still do you harm.
Wearing my mask was really important to me, not only to keep me and my family safe, but also I don't know what other people's situations are. I don't know if someone is struggling the same way I am or if they have the same conditions I am, and so it was really important to me to make sure I never put anyone in a position that I didn't want to be in either.
For the past 20 months, our healthcare workers have continued this perilous journey to deal with COVID-19 and make sure that other communities and other families don't have to go through the same issue.
As a physician, you encounter a lot of death and a lot of sorrow and a lot of sadness, but I think COVID has taken it to a whole nother level where as a human being, we have witnessed so much death and sorrow in these unfortunate times. I think sometimes everyone expects physicians to be kind of emotionless, and this job is not emotionless at all. And I think that's what creates our humanity as physicians, is that we grieve with the families, we hurt with the families.
Currently, we're in the midst of a pandemic and in a time that has been completely unprecedented. But as a Texas Tech Red Raider, you are empowered and taught how to think critically, scientifically, and analytically. And that has never been more important than now. And it's time to be able to use our thinking skills to understand the science behind what's going on and to understand that we're all in this together and that we have to work together to get through it so that we can be done with this.
When I got back to Texas Tech's campus, I was so happy to see my professors, my classmates, and just see all of the people walking around the campus. That's why it's so important for us to wear our masks and make sure we respect one another, so that way we can make sure that this virus is contained and it doesn't spread, and it can start with you.
I'm so excited to be back as a Red Raider this fall, and I urge you to strive for honor, keep your masks on, and protect your fellow Red Raiders.
You wear masks because you're trying to protect your teachers, and goodness knows, we need your help. And we wear masks because we want you to be safe and healthy and to enjoy a good life. So please, please wear a mask.
As the winter months are coming in and the cold season, flu season, and still COVID season are here, please continue to wear your mask to protect me so I can continue fighting for your families in the medical ICU.
From here, it's possible, and we will survive this pandemic together.